Welcome to the Wellness Revolution podcast, the radio show all about wellness in your mind, body, spirit, personal growth, sex, and relationships. Stay tuned for weekly interviews featuring guests that have achieved physical, mental, and spiritual health in their lives. If you'd like to have access to our entire back catalog, visit drveronica.com for instant access. And here is your host, Dr. Veronica.
Dr. Veronica, medical doctor, medical intuitive. You can get us on demand and online if there's something that you missed, because if you missed it, you want to go back and listen, because this is meant to change your life. There are so many factors that go into our health and wellness. You say, how can we keep it all together? Well, one way to keep it all together is to know about it. But knowing is not just enough. You have to do something about it. You have to take action. And so here we are in a day where everybody has a medical degree from the University of Google. And they come into the doctor office armed with their articles from the internet. And the ones that are even savvy, they say, I know how to search PubMed. Well, I don't know how you guys know how to do it, because I read that stuff on PubMed and I'm like, what does that mean? But I also understand that how information gets interpreted may be different than the actual data, and they interpret it a particular way to spin it so that people can do what they need to do. Now, understand about how the American healthcare system works. The government decides what healthcare that you get, even if you say, well, I'm not covered by the government. There's this big program out there, I'm sure you're aware of it, called Medicare. And Medicare, which covers people who are older and disabled and is a social benefit that we all fight for and we all believe that we do need. And I think there should be social services there. Don't think I'm arguing that there should not be any social services, but I want you to understand how this all fits together and this all works. So out there in Medicare, Medicare will only cover illnesses that they believe have a treatment that's pharmaceutical. Okay. So when you get testing and you say, well, why isn't this test covered and that test covered and this treatment covered and that treatment covered? It is because the tests that you get are meant to screen for what can be treated by some known pharmaceutical. Okay. So yes, it is put all together that way. You have to have a diagnosis and you have to have a treatment that goes along with it. And if that is not there, the Medicare is not going to cover it. And that's the way it works. Now you're saying, but I don't have Medicare, so what does it have to do with me? Every insurance company takes their cue from Medicare. They decide what gets covered and how much you're going to get paid. So people say, the insurance companies say, we pay a X percentage of the Medicare allowed amount. It's all based on what the U.S. government and the powers that be in the U.S. government who sit in the towers, and you don't even know who they are, decide. And they're playing with all of our lives. And so it's all done this way because it keeps certain people in power. There's a lot of money in sick people and poor people. And so you say, big pharma this and blah, 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 blah. What is the answer to this? Well, the answer to this is getting your own answer and investing your time and investing your money into keeping you well. Now, some of that is investing into buying good food that's real food, that's not contaminated food, which is really hard in this country because there are foods in this country that are allowed that are illegal in other countries, i.e. GMOs, genetically modified organisms. And the company that produced Agent Orange, you know, Agent Orange that killed a lot of people and maimed a lot of people and hurt a lot of people and made a lot of people's lives miserable in war, Monsanto. This is the company that provides the seed for our food now, and we trust them somehow. And you say, well, what's the big deal? Well, think about Agent Orange, and do you really trust the company that made Agent Orange being in charge, wholly in charge, practically of our food supply, who cut deals on the eve or Thanksgiving so that you don't know what's what? This is what happens. So I'm here to tell you that you say, well, this is a conspiracy theory. No, it's not a conspiracy theory. It's actually happening. It's not a theory. This is happening. Go search, go ask, and you will see it's happening. So Medicare will only cover what is covered because it is treatable by a pharmaceutical. And then that goes on to all the other insurance companies, and the government likes keeping you sick because it keeps you voting a particular way. And if you're well, you're powerful if you're well, because I'm not scared of being sick because I do everything I can to keep myself well and keep my family well. And so there was a time in the beginning of the year where I said, I'm not getting the insurance. I refuse to pay for insurance. I'll pay the penalty. I'm staying well. Whatever happens, the chips may fall, because I'm so confident in my wellness regimen that I was willing to take the chance. I'm like, I'm well. Now, why am I talking about this? Because there's syndromes out there that cause people major league issues that you can do something about, but are causing you problems. We don't talk about them a whole lot in traditional Western medicine, but they're out there and they're causing a lot of problems. And some people are aware of it now, but one of those is yeast. It's yeast. Okay. Yeast. You listened to this doctor a little while ago. He was wonderful. We were talking about the politics of heart disease. So I love to talk about politics. Dr. John Parks Trowbridge. We talked about the politics of heart disease before, but today we're going to talk about the yeast syndrome. So Dr. Trowbridge, he has such accolades. I'm not even going to bother because it's going to take too much time to tell you everything that he does, but I'm going to tell you to go to his website, healthchoicesnow.com. I know, Dr. Veronica, tell me about all his degrees and things like that. Well, you know what? There's a bunch of doctors with lots of good degrees, and they still prescribe for you medicines that are killing you, and you happily take them because they have a degree from the school, and they're the key opinion leader, and then blah, 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 blah. Go to Health Choices Now. Read about all the Dr. Trowbridge's background, and this is not taken away from all his accolades, because I definitely respect this gentleman, which is why I have him on the show. But I'm not going to waste time talking about it because I want to talk about the yeast syndrome. So Dr. Trowbridge's book is The Yeast Syndrome: How to Help Your Doctor Identify and Treat the Real Cause of Your Yeast-Related Illnesses. Dr. Trowbridge, thank you for being on Wellness for the Real World.
Oh, Dr. Veronica, thank you so much. And gosh, your introduction is so spot on, because Medicare is setting the standards across the reimbursement industry, which is really what it is. And if you don't have a recognized illness, then there is no recognized reimbursement, which means you are going to continue to suffer unless you figure it out yourself.
Yes. So let's get into talking about yeast. So first of all, yeast is one of those things that we know that's in bread, and some people say, well, Candida, and people are throwing around all these terms now. Tell people how they can suspect that yeast could be one of their problems. What will people notice symptom-wise?
Gosh, that is such a great question. The thing that is the real tip-off with yeast is you have something wrong in each of your systems. You've got a rash, you've got belly discomfort. If you're a woman, you might have menstrual or PMS issues. If you have joint pains, if you have headaches that aren't explained, if you're tired with fatigue. If you just say to yourself, why am I falling apart? It might be yeast. So think yeast. If you're on the medical merry-go-round, you just keep seeing doctors and getting prescribed drugs or even offered operations that are often not necessary. That's a simple way to look at it.
So you mentioned just a cadre of symptoms which can go with so many different disorders. How are we to distinguish that from yeast versus something else? And even more importantly, I can go to the doctor and they'll say, well, you have this because of that, and it has nothing to do, and you have this because of that, it has nothing to do with yeast, has nothing to do. And every one of the symptoms that you mentioned, usually some other explanation that can be discovered. So how do we know it's yeast versus something else?
That is so true, because actually diagnosis is really the key to medicine. If you don't know about it, you won't look for it. If you don't look for it, you won't find it. If you don't find it, you won't treat it. So if the doctor dismisses the yeast syndrome as a problem, he's never going to treat it for you. Now, here's really what people can do. Understand that it is important to find out if you have troubling symptoms They might be from a particular cause that needs to be evaluated very specifically. Now, a simple thing to do is to avoid sugars and starches. That would include things like fruits and sugary drinks and fruit juices and so on. Avoid that at least for a week. But good heavens, if you can do it for 30 days and you start to feel better, you have to be very suspicious your problem might be yeast, because sugars and starches will feed the yeast. The reason you get sick is it's not a yeast infection like everybody knows about, jock itch or vaginitis or athlete's foot or whatever, but it's the infection inside your gut that is not seen, and those yeasts are putting out poisons that go throughout the entire system and poison your organ functions. That's why so many different things can be related. So if all of a sudden after limiting sugars and starches you're feeling better, think yeast.
So in today's world, everybody is giving up gluten because gluten has been the bad boy or the bad girl.
Yes.
And people can give up gluten and still feel a little bit better, but not totally better. You had mentioned not just giving up something like gluten falls under the sugar and starch area for people who don't know that. If you give up gluten, you talked about giving up fruits, but fruits are good for us, right?
Absolutely. All the foods that we eat are good for us except for, the processed sugars and so on. The problem is you're not you at that point. You're being impaired by yeast toxins that are circulating around. Remember, this is nothing personal. There's the plant kingdom, the animal kingdom, the fungus kingdom, that's yeast. And the fungus kingdom is busy eating the other two, so the yeast are just trying to make a happy meal out of you. That's all it is, nothing personal. And those poisons interfere at every level. Now, when we talk about gluten, that's kind of a funny story because, number one, I think yeast changes in your gut can induce what looks like a celiac or gluten pattern. But, you were talking about Monsanto. There's Roundup traces in every grain that's now commercially available for us. And Roundup itself induces what looks like a gluten enteropathy. In other words, it makes chemical changes to the lining in the intestine. It's not really celiac disease. It's not really gluten intolerance, but gluten will aggravate it because the Roundup has damaged you. And if you've got Roundup and yeast, you're in trouble.
So that would be everybody in the whole of the United States.
Pretty much.
Because even today, you can talk about this a little bit, that even babies are born with lots and lots of chemicals in their bloodstream. Tell us about children being born today with all these toxicities.
Dr. Veronica, that's a real issue because back in the old days, we didn't have all these chemicals floating around. In fact, under your kitchen sink, you have more chemicals than the standard chemistry lab had in its whole lab about 115 years ago. So now we've got exposures that have never really been tested, and they damage our defense systems as well as others. But certainly, if your defenses go down, you're much more prone to develop things like the yeast syndrome because you no longer can fight it off. And, people go back and forth to the doctor constantly. These folks who get urinary tract infections all the time or sinus infections, bronchitis, pneumonia even, those folks are so damaged because of the antibiotics that have killed the bacteria but encouraged the growth of yeast, and then yeast invites the bacteria back in. Nobody notices. It's kind of funny because in my practice area down in Houston, there are doctors all over the place who go, "Oh, that's nothing. Don't worry about that. We'll just treat your infection again." Again? What about restoring the defense system? You were talking about we can take steps to restore our own health.
Yes. Restore your own health. Now, people are saying out there we like to be reductionists here. So let's do a little reductionist talk. All right.
Okay.
So, well, we want to get, everybody asks me, what test will you get? I do dinner talks and I might talk an hour and somebody will call me over and focus on what test. We love tests. So now let's talk a little bit about testing. Now, let me just say, for a lot of this, you don't just make a diagnosis based on a test result. And if you're going to your standard lab, they're very, very subpar at picking up this type of information that you need to figure out about these type of yeast. And you generally have to go to doctors who have accounts with labs that specialize in being able to find these type of situations reliably. It's not LabCorp and Quest, by the way, which everybody goes to. It's other labs that specialize in this. So let's talk about you. Part of the diagnosis is going to be a clinical diagnosis, which is going to be based on, okay, you have all these symptoms. Let's do some elimination. And here's exactly what we need to eliminate for a particular amount of time to figure out what's going on. Part of it is going to be elimination, and not just elimination, but re-challenge. But there is tests that can help people discover whether they have too much yeast and other types of organisms that are causing problems. So talk about some of the testing that can be done for this.
Well, that's exactly correct. There are some tests, but of course the best test, like you say, is the elimination and then the re-challenge, because if you notice that you're getting better by doing something, gosh, who is in charge of your health at that point? There is a test that was developed by a friend of mine, Dr. Ed Winger, who's an immunopathologist, and that was over 30 years ago. And it's measuring antibodies to parts of the yeast that are inside the organism. It's not one that everybody would see. You can't measure that because then everybody would have antibodies to the outside part of the yeast. Now, here's the glitch where it gets really kind of funny, because doctors tend to interpret tests real straight up. Oh, that's high, that's a problem. Well, in the yeast syndrome, if these antibody levels are up, that means that your body is responding to the attack. But you can have antibody levels that look normal because either you don't have the yeast syndrome problem or you have it, you gave up, you're not fighting anymore. Those are the more worrisome folks. Now, immune systems get in trouble. We know about chronic virus illnesses and, recurrent infection problems and such. Immune system evaluation becomes very important because we've got to boost you back up. Actually, Dr. Veronica, that's the real key. We don't worry about the yeast. We can suppress the yeast. We've got to build you up from the damage that the circulating poisons have created. That's the yeast syndrome.
So what does one, we talked about, okay, maybe you don't want to talk about what should a person say when they walk into a doctor's office and they suspect a yeast syndrome? Now, let me just say this. If you walk into your doctor's office and your doctor poo-poos the whole thing, you need a new doctor. Number one, get a new doctor and realize that doctor, because they're doing innovative, and this is not innovative, it's back to the way the creator wanted it all to be, but it's considered, being natural and working with the body is considered innovative now, right? Am I true?
Absolutely.
Okay.
Absolutely.
So you go to a doctor and they say, oh, that doesn't exist. What they really mean is, I don't have enough courage to tell you that I don't know anything about that. That's doctor speak. When they say, oh, don't worry about that, that means they don't know the answer. And so therefore it doesn't exist and you shouldn't worry about it. Turn the other way and run to somebody else and find a doctor who will say, that's a good thought. Let us explore that. The doctor that says, that's a good thought. Let us explore that is the doctor office you should be in.
Exactly.
So now what do you do next? You go into the doctor's office. The doctor said, you say, I think I have yeast. What should happen next?
The scary part about what should happen next depends really upon the skill and experience and knowledge base of the practitioner, the doctor. What frustrates me is for over 30 years now, I've been teaching doctors around the country and around the world how to treat the yeast syndrome. And for the most part, they don't quite understand. They think of it more like a yeast infection and say, oh, well, we'll give you, 3 or 4 weeks worth of treatment and you'll be fine. Now, the problem with that is you may suppress the yeast slightly, but not enough to rebuild the problems that the toxins have created. And then you can spend dozens of months and dozens of thousands of dollars to chase down everything else because, as the doctor says, well, we already treated yeast. That's not your problem. Now let's figure out what else it is. And they didn't actually treat the yeast. So I suggest taking a copy of my book. Obviously, I'm going to say that's the best one out there because it really is. But anyway, it has the medical references in it and so on, and encourage your doctor to read it. Most often, what my patients have said is that the doctors just toss it back and say, I don't read about stuff that isn't real. Unless you're the one really suffering with it, that's a problem then. Yeah, but we have to educate the doctors one by one. That's the frustration, is we're not taught this in medical school. It's a different kind of infection and syndrome.
Yeah, it sure is. And we've been brainwashed by and large. Would you agree?
Oh, absolutely. And Dr. Veronica, the worrisome part now is that studies are showing, we can look now genetically at a lot of stuff. Studies are showing that the yeast, the common yeast, the Candida albicans, which everybody has, and that's the usual one causing the syndrome, is very sinister. When you start throwing up a defense pattern, it just activates other genes and goes around the side. And it's very responsive to your attempt to control the infection.
So when someone has to be treated for yeast, is it just give them an antibiotic, an anti-yeast antibiotic, or is that one of the worst things that we can do?
No, it's actually a good thing. What I tend to do is start people out first with dietary changes, like we're talking about the sugars and the starches. And secondly, we ease them into some nutritional supplements that help support their systems that are obviously crashed because of the yeast. That would be essential fatty acid, magnesium, B6, and so on. Those are pinch points in the metabolism where the yeast toxins are really interrupting. And after a few weeks of that, then we add the anti-fungus medications, the yeast treatment medications. And those then start squeezing harder on the yeast until we get you on a stable, safe, simple regimen of medications and supplements and dietary limitations. And rebuilding you takes as long as it takes. It's not like, well, we have to control the yeast for so long. No, we control it until you're better, and then you don't have to worry about it because your systems are competent again. You can take care of it yourself.
So that's my next question, because people say, how long does it take? In your experience, I know there's no average. There's no average person. Everybody's a little bit different. But give us an idea of how lengthy this can be, because it's not just we give you a week of treatment and you're better and that's it. Is it? Would you say people on average take 6 months, 9 months, a year? What would it be?
Dr. Veronica, the older you are, the longer it takes, and I think that's because there's been more damage to your systems. Certainly the toxic chemicals and toxic metals have already damaged you. The yeast toxin just does even more, so it just takes longer to get you better. In my early experience when I was still taking care of children, which I don't do now because I can't stand the parents, I would have parents say, my daughter clearly has this, can you treat her? And I'd say, yes, but you'll be unhappy. And they'd say, why? And I'd go, because she'll be finished months and months and months before you will, because her body chemistry will respond very quickly. I'll give you an example. I have a college-age young lady who came in less than a year ago, and she's been dispatched to enjoy her life because she's all better. And that's a patient compliance issue. So kids can get better in 6, 8, 10 months. Older folks in a year, maybe a little longer. And the older the folks, adults like me and such like that, can take 12, 18, 24 months easily. It also depends on, do you have things like sinus congestion problems? Because that's really where the yeast lives and loves to reseed from there. So we really pay a lot of attention to pockets of yeast that can get you in trouble in the future.
Ah, interesting. So what step number one for somebody who suspects that they have yeast is to cut out what? What are if you want, before you go to the doctor, exactly, you say, sugars and starches. What compromises sugar and starches? Because we got to be real specific to people. But before you answer that, we know that there's a problem with artificial sweeteners. And
right.
Artificial sweeteners may, in fact, be worse than actual sugar itself. So is there an issue with artificial sweeteners? Because people say, okay, I'll cut out the sugar and I'll just go to an artificial sweetener because they have that sweet tooth, and the yeast have that sweet tooth too. Are artificial sweeteners okay in somebody who has yeast?
Artificial sweeteners aren't okay in anybody. How's that? Now, the ones like stevia and such, xylitol, erythritol, those are fine. Those are natural things that are sweet. But when you start getting into these chemicals, no. Those are neurologic toxins. And remember, the brain and the immune system are very, very close in relationship. If you're damaging one, you are damaging the other. I don't like the artificial sweeteners for anybody. So it's kind of a cold turkey type thing. You decide, I really want to go off anything that's sweet like that, sugars and starches, especially added or processed sugars, starches, all the baked goods and so on. Remember that the alcohol, the beer and the wine and the brewer, the distilled stuff, those are all yeast-related products. How about anything else that's, fermented by yeast? Gosh, avoid those. Go into the doctor, and if I have patients who come in and have been 3 or 4 weeks off these things and saying, I really am feeling a lot better. Oh, boy, that just makes it easy. And they're already convinced that they can be in control of their health. And Dr. Veronica, that's really ultimately the issue. Who's going to run your health care, you or your doctor?
You mentioned fruit also.
Yes.
What
yes.
Is it all fruit, or I caution my clients against the ones that are the more sugary, and I specifically give them a list and tell them to stay off those particular ones that are down there. Particularly, don't eat any of those. What do you tell people about fruit?
I tell people for that first several weeks, we're going to keep you off everything. I call it the MEVY diet: meats and eggs, vegetables and yogurt, MEVY. And there's some people who can't do the yogurt because of a milk intolerance or whatever. That's fine. And we have a list. We call that the phase 1 eating. And these kinds of things are described in my book. And then phase 2, we advance you to some things like some melons and some specific cheeses and some other vegetables. And we're kind of going up the allergy potential as well as the sugar containment. And we advance you slowly as you're able to tolerate more and more eating while we're still repairing you and controlling the yeast. So it's a graduated thing, and I agree with you totally. Fruit's wonderful. It's much more important to eat fruit than it is to eat candy. How's that? But again, there's no brand of commercial available orange juice that has been found without yeast contamination, even the frozen ones. So yeast is everywhere. It's useful for our food production. It's tasty, just not when you're sick with it.
Yes. And you're listening to Wellness for the Real World. I'm talking with, or have talked with, Dr. John Parks Trowbridge. His website, healthchoicesnow.com, healthchoicesnow.com. We were talking about the yeast syndrome. His book, The Yeast Syndrome, How to Help Your Doctor Identify and Treat the Real Cause of Your Yeast-Related Illnesses. If you're having a bunch of problems, you're breaking down, think yeast. Get his book so you can at least start. So when you walk in, you'll be armed with the data to get yourself well.
Thank you for listening to the Wellness Revolution podcast. If you want to hear more on how to bring wellness into your life, visit drveronica.com. See you all next week. Take care.